Hello, and welcome to the Viva la Vulva podcast. I am your host, Dr. Cara Quant, and I have an so special guest on the podcast today. Dr. Chantal Lunderville is a person that I met, is a woman that I met in medical school. We went to UCLA together, and wanted to give you some information. And we're going to be talking today all about vaginal health and sexual health. So thank you for coming on the podcast, Dr. Lunderville.
You're welcome. Thanks. I'm super excited to be here and talk about these topics with you.
Yes. So giving a little intro about Dr. Lunderville, she is originally from Southern California and went to med school at UCLA, like I said. And then she also went to UCSF for residency for family medicine. She is mixed race Latina and always felt committed to helping other women and women of color feel empowered in their health and their lives. Yes. She currently practices family medicine in San Francisco, focusing on women's health and supporting mental health. She also started her own concierge medicine practice called Elevate Spa to treat women in their homes and their spaces, specifically designed as a concierge medicine for women, which focuses on skincare, aesthetics, and supporting all ways we care for ourselves inside and out. And I am so happy that you have that last sentence about like taking care of ourselves inside and out, because I feel like self-care is such a huge thing. And I've had other people on the podcast talking about self-care, and it's important. It's important that we take time out for ourselves and do things for ourselves that help us feel better, feel more alive, feel more ourselves. So I love that.
Yeah, I completely agree. And I think, self-care isn't just a bubble bath or, it is that, but it's also just all the ways that you listen to your intuition, your needs, how you express that. It's basically everything you do in your life. And is that all aligned with kind of serving you?
Yes, I believe that to be true also. So jumping into the sex convo talk, I want to get some information from you, and I actually like asking this question to a lot of people, not just on the podcast, but just in general. But how did you grow up thinking about sex? Like, what info did you get about sex as a young girl or adolescent?
I love kind of reflecting on, I think, the growth that I've had in, at least in terms of thinking about this, because when I was growing up, I don't know if it's a Mexican thing or Latino thing, but it was basically like, all associated with like the negative outcomes, like, basically don't have sex for as long as possible because men won't value you as much. You could get pregnant, and that we don't want that. And so it's really this kind of model of risk-based disease model around sex. And I think I didn't really confront that until I was in my medical training, and I stumbled upon this research about how the Netherlands has such better outcomes in the US in terms of first-time condom use for teenagers, teen pregnancy, STD testing and rates. Like all of their basically public health measures around sex are dramatically better than ours. Mm-hmm. And so there's a lot of literature around why is this? And it's really kind of come down to the ways that we talk and think about sex. So in the Netherlands and kind of more kind of progressive industrialized countries of Europe, the conversation is around, love isn't some like grandiose concept. It's very common. It's okay to experience this as a teenager. It's normalized to talk about sex at the dinner table. It's not kind of so clouded in shame. And so I think looking back on my own experiences as a young woman, my experiences were very much like, don't do it, otherwise you get these bad outcomes. It's kind of like that Mean Girls shot when he's like, if you have sex, you will get chlamydia and die. It's like a very good glimpse into the American psyche.
Sex education, yeah, that's how it was taught.
And so when you do this, you completely eliminate the concept of pleasure. you eliminate the concept of empowering women and men to understand what their body parts are, what they do, what they function as. And when you do that, you completely kind of eliminate our ability to talk about it in a normalized way and ask questions and explore and kind of open yourself up to what your relationship can hold and kind of the ways that you communicate around your needs, your boundaries. And so that's why I became super passionate about having these conversations with my patients, because I think sex is the way that we navigate a lot of these things in our lives and and answer bigger questions in our lives about what gives us pleasure and how do we communicate our needs. Mm-hmm. So yeah, I was a very common American teenager. Let's just say that.
And, I agree. I think that a lot of how we base pleasure and the concept of pleasure and the surrounding ideas about it, whether it's shameful or good or bad or whatever, came from our childhood. Mm-hmm. It really did. I mean, even the anatomy terms, like I feel like there's not a lot of parents that talk about, hey, this is your vulva, this is your penis, this is your, we give different terms for it. And I feel like that even adds to the shame. It adds to like, well, why can't it just be called the normal anatomical term for it? Like, why does it have to be called down there or your noonie or your, so there's so there was, even for myself, like I never said vulva or vagina. It was always down there or my privates or, so yeah, even the anatomical terms that we use or don't use and teach our kids is very important. And I know for myself, I feel the same way or very similar. There was not a conversation around sex, especially from my parents. And I remember my mom being very hesitant about talking about sex. And she gave me a book. She gave me I don't even remember what it was called, but something about all the things that you need to know as a teen and for sex. And so she gave me this like question and answer book, and that is what I had. So if I didn't ask any questions from it, I looked in it, and that was her way of doing it. And now thinking back on it, that was just what she could do. That's what served her. And but there wasn't a lot of information to me around sex and pleasure and masturbation and, all of these things that I feel are shamed in our culture.
Right, exactly. And kids are just getting these, implicit and explicit messages all the time, like we don't want to talk about it or don't touch that area. And kids, when you study child development, kids become naturally very curious about their genitals, even as early as age 6. And it's so important to just, talk about it without imparting that implicit shame around it. And so it starts very young.
It starts very young. Yes, it starts very young. And what are some common things that you talk about with your patients around sex? You said you told me that you were open with talking about with your patients about it. And so, like, what are some common complaints that patients come in with, or what are some common things that you talk about with your patients around sex?
Yeah, I love this question because it's really interesting when you've been in practice for a little while and then you kind of see the themes. I'm sure you see it as well. Mm-hmm. But in my family medicine practice, a lot of the themes I see are around desire. So desire meaning, I just don't feel as sexual anymore, or my partner wants it all the time and I don't, or I want it and my partner doesn't. And so as a physician, my job is to kind of figure out, okay, is this something physical? Is it, vaginal dryness? Are you having enough foreplay? Are you perimenopausal? Do you have spasm? Do you have a history of trauma? There's a whole list of physical manifestations that we can talk about. And then there's that whole other emotional side, which I love to talk about, which is what are you doing to kind of stoke your own desire? So after you kind of figured out the physiological barriers you may or may not have, what are the things that you're doing to kind of feel sexual in your own body? And I think this is one of the most important things that I try to impart with my patients, because it goes back to our mental health. For example, I had this guy who came in for insomnia, right? And I could just tell he was a little bit kind of guarded. He tried not to express emotion. And I kind of asked him a little bit more, like, how long have you had this problem of not being able to sleep? And, he said, like, ever since I was pretty young and, early 20s. And then I kind of asked him a little bit more about how he relates to other people, how his relationships are. And it kind of turned out, and it actually took, a few appointments, but it turned out over time that he had had a bad sexual experience with a woman because he was uncircumcised and she had said some pretty disparaging things to him after he wasn't able to perform. And so, sorry. And so he wasn't able to perform. And then after this, and, it's incredible the amount of insight that he had, that he was able to see, I really shut down emotionally. I didn't really, I was afraid to approach women. I was afraid to put myself in new situations. And so not that everything that patients come in with relates to sex, but so much of kind of how we trust other people, we interact in the world, we choose intimate partners, has to do with kind of how safe we feel in our bodies and how safely we're able to be vulnerable with other people emotionally and physically. So I often find myself including sex in a conversation around mental health, wellness. And I think every practitioner needs to do so, because people deserve a good, a healthy sexual life. And a lot of times our issues are played out in this arena. So mental health, around sexual health, as well as mismatched desire, are probably the biggest things I see in primary care. Mm-hmm. And on the second token about desire, I really try to get my patients to see desire as not something that you derive from the other person. Like, oh, this person does something that they don't do this thing enough for me. They don't initiate sex enough for me, for example. And I really kind of base what I talk about off of Esther Perel. And one of her books, Mating in Captivity, she really talks about how we are sexual beings in our own right, and how we take care of ourselves, how we tune into ourselves, how we masturbate, how we work out, how we groom ourselves. All of these things relate to kind of our own sexual fire. And so I really encourage my patients to stoke their own fire first and just see kind of the magic that happens afterwards.
Mm-hmm. Yes, yes. And I've been following Esther Perel. I haven't read or it's Mating in Captivity, right?
Yeah.
But that is like on the list of books that I want to read. But I have been reading Pussy by Regina Thomas Hauer, and is talking about the same thing, is that we need to, for women, connecting with our vulva, our source of power, and really, yes, stoking our own desires and our own fire before giving it to other people. Because our cup can only be, we can only serve other people when our cups are full. And when our cups are empty, then that just can't happen. And for women in society in general, I feel like there's a lot of discussion around, like giving to other people, serving other people, doing things for other people, but not necessarily doing things for ourselves. And so I completely agree with you.
Yeah, I think this issue particularly plays out for women because of socialization, sexism, we learn to put the needs of other people before ourselves, very early on when we're preteens.
Yeah.
And we take in these messages of how to serve pleasure to other people. And I think there's almost this like reawakening that happens as you kind of get into your 30s and 40s of, well, what is serving me? How do I derive pleasure? And so your framework really shifts. And so I love supporting this process for especially women. Yeah.
Yeah, yes. And I was also going to say, yeah, as a teen, and I don't know if I do want to say this, but as a teen, I did feel like pleasure was for my partner. As a young adult, I felt like pleasure was for my partner and not for myself. And I just think to myself now, like, how is that possible? Like, why would I think that? Like, it almost makes me
No,
cringe inside. But
no.
I know that there's so many people that feel the same way now. They, you know, in whatever, at whatever age they're at, there is some part of them that's like, I feel like sex is for the other person. It's not for me. It's not for my own gratification and orgasm and whatever.
Yeah. Well, I have my vulva story that I wanted to tell you, but we could save it for later, but it has to do with this.
Okay. Okay.
Can I say it now or let's wait for later?
No, you can say it now.
I think what really helped me when I was going through a pretty bad breakup and I found myself really cut off sexually. And I kind of wanted to explore like why was that? And it was because I really felt that in all aspects of my life, I was very much hyper performing. I was, I had to be more of like in my masculine. And so, and every person has masculine and feminine, men and women. And then I kind of did a little bit more work around meditation. And I listened to this podcast called Rewilding, and I explored a lot of what feminine and masculine energies can provide in the sexual space. And for me, I tend to be someone who enjoys to be the feminine in a sexual relationship, but I'm so masculine throughout my day, and that really it hinged upon safety. Am I able to really let go in a complete freeform way in bed that I'm not able to do in my life? And so it was really through a lot of meditation, a lot of rituals, a lot of kind of manifestations that I was able to really let go in this space. And we could do a whole nother podcast about what that means. But I think that there's really this empowerment that comes from owning your feminine again. Because I think a lot of times I felt unsafe to really be feminine, to ask for help, and again, everybody has masculine and feminine, but oftentimes I inhabit that, dominant boss lady kind of, attitude in my life. And so kind of softening to what the feminine is in the sexual space for me was pretty transformational.
That is powerful. That is really powerful. Yeah, and I have similar stories of me and other people noticing the more masculine inside of me, and it's like, well, like, where's the softer side of Cara? Like, where's the softer and more feminine side? And I'm like, it's here, right?
I
Maybe
feel
it
beautiful.
hasn't been as present as I thought it has.
Yes. And there's equal power, equal value in each of those. And I think that, I think society tends to look at feminine qualities as less valuable, and I even did that myself when I was like looking at my mom or people in my life. And I'm like, I don't want to be the caretaker of other people. I don't want to be, a doormat, because I was looking at a feminine quality of like taking care of other people or holding space as bad. And everybody needs boundaries, but really kind of owning what are the feminine and masculine ways that you can express yourself safely and with your boundaries, and who do you do that with and when do you do that with. I think that really is when you're able to kind of shift into both areas and kind of have you live your life on all cylinders, rather than like, okay, I'm just going to completely shut myself off from those feminine energies.
Yeah. And what Regina Thomas Hauer, or Mama Gina, says in her book, is bringing women together, like having women come together in circles and in just space for themselves, and bringing more of that feminine energy and power, because you see it in other people, you see it in other women.
Yes.
So that I know is a powerful thing. And I've started doing some like very small groups with people, with women, and they're very powerful.
I want to come. Where's my invite?
I will send you one. Yes, I will definitely send you one. But it's a powerful thing. It's a powerful thing to get with other women, because I think that what has been told to us is that women are very catty, women are very, vengeful, women are, they'll take your man, they'll take your partner. they're just gonna like do for themselves. And I feel like women are not that way. Like women love supporting other women. Like women love helping, and I mean, I feel like that's a natural part of us.
Mhm.
Just supporting other people in their process. So I do not believe that that is the case. I think that we've just been given those ideas over time that women don't support or are mean to other women, and that's not the case.
Right. And if that's what you're experiencing, find new women. Like,
Find new women.
find new women, because let me tell you, there are women out there who want to see you shine and lift you up and support you in every way that you didn't even really know possible.
Mhm.
Um, and so that's what you deserve.
Yes, that is what we all deserve. But that
We
is what we
all
all
deserve
deserve in life. Yes, we are
this.
all very worthy and deserving of that support.
Exactly.
Hmm. So now let us get on to vaginal health, because I think that this is important, and this comes up a lot with my patients. I see patients on a regular basis. I am seeing a lot of women. Women are coming in with vaginal issues, either UTI or vaginal discharge or whatever, and I feel like I wanted to do something to talk about vaginal health and how to maintain or have a better vaginal health. So I want to have talk about 6 ways of better vaginal health in our lives. um,
Mhm.
so actually, first I wanted to ask you, what does vaginal health mean to you as a woman, as a doctor, in
Oh,
general?
yeah. I love this question because I think very typical clinical medicine is going to define vaginal health as, a low pH, free of any infection. But, that, I mean, it's true. My vagina feels great when I don't have any bothersome symptoms like itching, excessive discharge, et cetera, et cetera. But beyond that, a healthy vagina is also, being in touch with, what does she want? How do I take care of her? And it might be different depending on the season or depending on what your diet is. It's also feeling that you're not ashamed when you have a sexual experience or when you masturbate. Kind of the ownership of your anatomy and the state of your vagina. I think there's so much shame around, like, oh, I need to like shower before, I need to like do all of these other things because my vagina, it's almost this message of like my vagina is inherently dirty. And
Yeah.
you should be the boss of what you decide of like what makes you feel the most comfortable, but also examine those ideas of like what is going on down there is not shameful. And everyone's different in terms of like what they feel the most comfortable, kind of their state of what's going on down there. So it would be absence of disease, but also kind of like feeling empowered and proud of it.
Yes, I agree. I think that vaginal health for me is having, actually, this is what I've wanted for my whole life, but having a safe, but not a safe vagina. Having sex that pleasures me, that supports me and uplifts me. Having a healthy vagina in terms of, yes, lack of diseases, lack of discharge, lack of irritation, things like that, and a prolonged sense of wanting pleasure. So, like masturbation, either from a partner or myself. Like, I feel like that is what is considered vaginal health for me. Maintaining the happiness of my vulva and my vagina. Maintaining the happiness. Yes, I like that.
And I think even just inherent in that idea is that we pay attention to it, that it's something that we actually are intentional about. What am I going to do to take care of my vaginal health? If that means eating more yogurt, cutting down processed sugar, and just having it be in our consciousness as another part of our health that we maintain, rather than kind of this passive, you know, cavity that we just sort of make sure there's no disease in. So I think just even having the intentional kind of wisdom around like what we need at any given time is so important.
Yes, it is very important.
Yeah.
So, getting to the 6 ways, what is number one? And we'll just go back and forth with sharing some tips from our lives, from what we've learned in medical school, or just in general about maintaining vaginal health.
Yeah. So I love to talk about probiotics because I think that they're just so generally accessible. They're a really great way that we can kind of take power over improving our vaginas because it's not a medication, something we can incorporate every day. So probiotics are great because it's basically lactobacillus, one of the main colonizers of the vagina. That's like a healthy bacteria of our flora. And the power of lactobacillus is pretty amazing. It forms adhesions, which is kind of a barrier, a natural barrier, so that other infections can't grow, like BV, Gardnerella, even gonorrhea, chlamydia helps prevent infection. And then it also creates some weak acids, keep your pH low. And the way you can get probiotics is either, taking some over the counter. You don't need a prescription. You can also eat fermented dairy products, yogurt. So I think it's a wonderful way of just kind of maintaining your vaginal health every day. So especially during a time that you take antibiotics, if you're someone that gets like UTIs or you have a URI, like a cold, that's going to kind of set you up to throw off your flora. So just take, if you don't normally do probiotics, then do it during this time when you're more susceptible, or kind of double up your intake during those times. So I love probiotics.
Yes, and I agree with you. I actually attend this conference every year, and I've said it on the podcast before, but it's ISHWISH, or International Society of the Study of Women's Sexual Health, and
Mm-hmm.
they talk about probiotics, and if a woman is more prone to yeast infections and BV, taking probiotics can bring the pH back to a normal level, to where they're not at risk of getting these infections. So there is lactobacillus was one of the big ones that they were talking about with in terms of maintaining a healthy pH.
Yeah, it's
Mm-hmm.
incredible the things that you can do with probiotics, or at least all the things you do to maintain a low pH, which, that acidic environment is going to help prevent an infection from growing. And, it even relates to things like fertility. Like if you have a good pH, your chance of getting BV is less likely. Chronic BV, we know, can actually lead to infertility from tubal factors, protects you against STDs. Obviously not the same as like, let me skip a condom and just use my probiotics.
Yeah,
Definitely don't advise that.
no.
But it's like an extra way of helping protect yourself in addition to, the safe sex practices that we know about. But yeah, preventing infertility, lowering your risk of getting pelvic infections. So it just relates overall to like short-term and long-term vaginal health, which I love.
Yes, and the second one I want to talk about, which goes along with the first one, is maintaining a healthy pH. And so you're going into it, but a normal pH is around 3.8 to 4.5, so it's on the lower, more acidic side compared to the rest of our body. But there are certain things that can cause our pHs to rise, like BV, like taking antibiotics, which removes the good and bad bacteria from our vagina. There's also a lot of lubricants that are out there that can do it. Um, Sorry to say it, but like KY, Astroglide, Replens, those are not good lubricants. And the reason why is because it has some ingredients in it that can cause a lot of vaginal irritation and can mess up the pH. So those products include parabens, include glycerin, include propylene glycol, benzocaine, chlorhexidine, which we do to like clean wounds and things like that. So these lubricants that are supposed to help us in terms of ease of sex, or more pleasure in sex, are actually, or can cause more irritation and can cause increased risk of these other infections that we're talking about. So I would recommend for anyone out there listening, especially if you are a vulva owner, to not use the KYs, the Replens, the Astroglides, and really to look at the lubricants that you are using and putting in and around your vulva, because they can make a difference. And I actually will counsel a lot of patients on this about, hey, like what, people ask me all the time, or women ask me all the time, what am I doing wrong? Like, why am I always coming in every month with a different infection? And I'm like, you have to look at the things that you're doing and putting around your vulva, lubricants, even latex, condoms can do it. Antibiotics, recent antibiotics can change the flora, and so it can lead to more yeast infections. The soaps that you're using, not using things that have a lot of fragrance in them. So all of our vulvas and our vaginas are very sensitive and only need the very best products that aren't irritants for it. And so really, I will write this in the show notes, but and exactly what products to avoid using in lubricants and in other products. But those can definitely change the pH and cause some issues. And what can help it, like you were saying, for our first tip, is to use probiotics.
Yeah, I love that you mentioned how sensitive the vagina is, because I think what I do a lot of times with patients is I'm really educating them on, I know no one's probably told you this before, but even just the skin of the genitourinary region is super delicate. It's not like the skin on the rest of your body. So even if your vaginal flora is okay, some of these products with a lot of fragrance, even panty liners that contain fragrance, that can really irritate even just the outside.
Yeah.
Can cause problems on the inside. So I really, I tell all my patients, only warm soap and water. If you are going to use something around the vagina, use one of those pH balanced formulas that they sell at the store. It's not just a marketing thing. Or you can use something with like Dove if you're able to tolerate it. But I know a lot of women that they can't really tolerate anything except just warm water. And it also relates to, I see a lot of folliculitis in the area, a lot of kind of the new ways to remove hair, kind of the trendy things can also be super irritating. So if you're getting recurrent infections or folliculitis, one of the ways you can help is just using like a little electric razor and leave about 1.5 inches, about a few centimeters of hair. It's not going to be the most, trendy in terms of hair removal, but it might be helpful during the time if you're having a lot of infections and things like that, because a lot of the ways of removing hair are really irritating.
Are very irritating. And I actually had a woman come in recently, and she has been waxing, and she waxes every couple weeks, and she gets ingrown hairs like all the time. And she's like, I am in pain. These are painful. They can lead to infections. And so I was like, I think that you need to stop that right now. Like, waxing is, I understand, the aesthetic of it. But it's not helping you. It's giving you a lot of pain, and a lot of bumps are coming up from it.
Yeah, I know that there are some differences in the types of wax that people use. I know that slow wax is a little bit better. It's less irritating.
It's called slow wax?
It's called slow wax, yeah. And unfortunately, it does take longer and it costs a little bit more, but it's way less irritating. So it's also an option if women are just committed to waxing and they want to find a little bit of a less irritating alternative. You can find a salon that does slow wax.
Slow wax, okay.
Yeah.
All right. So on to tip number 3 for better vaginal health.
Yeah. So one of the things we talked about was preventing infection. And sometimes you can have these infections, especially chlamydia, where you don't know that you have the infection. And so it's really important to do regular STD testing. I've even had patients who have been with the same person and they, came up positive because they had just something that was a little bit off, or, so even if you've been with the same partner for a while, it's okay to get periodic testing. It's just to protect yourself out there. And your doctor can also do bedside trichomonas testing if they have a microscope, as well as BV. So it's important to just come in and ask your doctor, hey, I just want to, get a regular STD check. And if you do a vaginal swab, it's more effective than a urinary source for your gonorrhea and chlamydia. So urine is still a great way to check, but if you want to be a lot more precise, then ask for a vaginal source of the gonorrhea and chlamydia.
Yes. Yeah. And I can't stress this enough. Regular STD testing is so important. It's so important. And yeah, even for the people out there that are married, that are in monogamous relationships, if a woman comes in with a UTI, I will usually check for gonorrhea, chlamydia. I will tell them that I'm doing that. And some of them are like, well, why? I've been with the same partner for years. And I just tell them that things happen. Things happen, and I don't want to put any negative energy out there, but I'm like, it's taking care of yourself. It's knowing your status. It's keeping up to date on what your STD tests are, and it's not a bad thing. And so I would recommend for everyone out there, men, women, everyone in between, to get regular STD testing, especially if you're having multiple partners, especially if you want to have condomless sex. If it's a heterosexual relationship or a homosexual relationship, yes, I would highly, highly recommend regular STD testing. And it really is so easy of asking your doctor. There's no judgment, there's no shame, there's no nothing. Just be like, hey, doc, or hey, whoever you're seeing, I want to get STD tested. And it's so easy. It really is easy. So if your doctor or your provider doesn't bring it up, please bring it up.
Yeah, it's really interesting because I've seen different practices where it's risk-based. So someone might say, this person is in a monogamous relationship, and they don't have any outside partners, so I'm not going to test them. I am of the school of thought that you never know, and I am doing a better duty to my patient to just take the extra swab, send it off, do a thorough workup, and it really just depends on how you frame it. I say, let's just send this test. We're going to be completely thorough and do a complete workup. And that usually, makes people feel a lot better, that it's not that I don't trust them, but I'm in charge of making sure, that we've ruled out all of these things.
That we ruled out everything. Yes.
Yeah.
Yeah, I agree. I do agree. So everyone out there, go get tested. You can. I think there's even. I mean, I've even seen like at-home tests. I don't know exactly how they work. I don't know how sensitive and specific they are. I know they are on the expensive side. But there are places where you can go where you can get free STD testing, especially HIV. So just look it up.
Yeah, if you don't have insurance, that should not be a barrier. Like Planned Parenthood, lots of different places in your community should be able to cover you for that.
Yes, exactly. So let's see, we're on 4. The fourth tip for improving or a better vaginal health is no douching. Avoid douching. I actually haven't had too many patients come in talking about douching, and I think that there is an overall understanding that douching is not good. But I've still encountered some patients that have come in that are like, yeah, I will use a solution to clean inside the vagina. And I'm like, no, don't do it. Our vaginas are like a self-cleaning oven. And I've actually never seen a self-cleaning oven before. However, it's the same.
I love that analogy. I'm going to use that. Can I take that?
Yes, you can take it. It's a self-cleaning oven. There's nothing that you need to do. There's no solutions or there's nothing that you need to put inside the vagina to clean it. It cleans itself. And the problem with douching is that there could be certain ingredients within the douching solution um, that can cause irritation. And douching also increases the pH of your vagina. It can cause the good bacteria to come out of the vagina. So again, increasing your risk of infection, increasing your risk of bacterial vaginosis, yeast infections, putting you at risk for STDs, gonorrhea, chlamydia, things like that. So I would avoid douching. Do not do it. Again, your vagina is a self-cleaning oven.
No douching of the vagina, no interacting or dating with douches either. Just no douche policy in general. One thing that I
policy, yes, I like that.
Yes. One thing that I do love is a sitz bath, where you just go in the bathtub to cover your waist. Only warm water, not too hot, nothing in it, no bubble bath, because bubble bath is also bad for your vaginal health. And it really kind of cleans everything in the area. Even just the warm water is really calming. If you have hemorrhoids, if you have any like type of localized irritation, super, super helpful. I talk about sitz baths all the time. Unfortunately, I practice in San Francisco and a lot of people don't have bathtubs, but
what?
Yeah, a lot of people don't.
They're small and it's just showers that they have.
Yeah, I mean, a lot of people don't. They live in apartments, you know, so, but you can create your own. You can kind of sit in like a little, if you have like a tub that's kind of smaller than a regular bathtub, but you can buy it and just sit in it for a little bit. But yeah, I love talking about that one because it's so easy and it's pretty helpful.
It's very easy. Yes. Yeah, I do talk a lot about sitz baths also.
Yeah.
Okay, so number 5 on the tips of better vaginal health.
So we wanted to talk about masturbation because masturbation is one of those things where I think people get a lot of mixed messages around, like, is it okay to masturbate when I'm in a relationship? Is it okay to masturbate to like someone else, maybe like my work colleague, even though I'm in a relationship? I think there's so many potential like gray areas when it comes to masturbation, but you know, masturbating in itself is super healthy for you. It's super healthy for your vagina, for your vulva, because you're able to kind of connect with, again, this desire that you're able to stoke yourself. It connects you with what you like, and your preferences change all the time. You know, you could like something one day and then the next day like something different, and kind of being in touch with that and communicating that to your partner if you do have a partner. It also is really good for stress relief. It's good for menstrual cramps. There's a lot of physical benefits of masturbation. And sometimes people ask, can you do it too much? Yeah, if it's getting in the way of like your job or your life commitments, then you know, there is such a thing as doing it too much. And you get in terms of this like addiction pathway. But, you know, here and there, even every day, a couple times a day, as long as you're able to live your life, masturbation is great.
Masturbation is great, yes. And we just had International Orgasm Day. No, Orgasm Day just passed recently.
Oh, really?
Yes. So happy Orgasm Day, or a couple days ago. But yeah, I mean, going along the lines of masturbation, orgasms are good. They can increase certain good hormones in our body. It can relieve cramps. It can relieve a lot of things. So masturbation is not bad or wrong. And what would you say to a person, a vulva owner that has a partner that's like, I don't like that you masturbate. You know, like I feel like I should be doing all of the sexual stimulation in this relationship. Like, what would you say to a person like that?
Dump him. No, I'm just kidding.
He's a douche, right?
No douching. We said no douche. You know, again, going back to sex is a way that we're able to navigate sometimes more challenging conversations in our relationship and express our needs. Super important to be able to assert yourself in this space. I would just use language that's centered around me. So if I'm someone who's like, I have this sexual preference or I have this practice that has nothing to do with you, focus it on me. So I say, I really enjoy kind of exploring my own pleasure. It really ignites my desire. So I'm able to kind of be excited about being together. I don't want you to think of it as anything that I do separate from you. It's more in terms of helping me to become more satisfied. And I think that it would help our relationship. And there are ways that you can incorporate your partner into it as well, like using toys, instructing them on things that you've learned. And if you're really kind of, really comfortable with your partner, you can share what were your fantasies. I think that even a lot of people might be scared to do that because it's kind of like their own, which in some ways might make it even more more stimulating to them to have it kind of be a secret. But I think that, I would encourage you to share with your partner what are your fantasies.
Yeah, I agree. And I think that sometimes that can be hard because for some people, it's like, well, what if this fantasy is like really weird? Or like, how is this fantasy going to be taken by this other person? But I think that is what vulnerability is all about, like opening yourself up to sharing what your fantasies are. And I think that does bring people closer together rather than pushing them apart. And however the partner responds to the fantasy. But I think it's better to share it rather than to just like hold on to it.
Right. I agree. I'm all for sharing.
Share
And
it.
I think when you talk about it, people have I think you always have to be conscientious of your partner's sexual ego too. We all have sexual egos where we do feel threatened sometimes. So I think always using very kind of language of ownership, like this really turns me on. What you do also turns me on. What if we did this together? It would really turn me on if you did this. I would really feel closer to you if we did this. Kind of like the language of how you become closer, how your partner can turn you on. And usually when you frame it like that, they will be excited to do those things because ultimately, if you're in a really healthy sexual relationship or partnership, you want to also see your partner achieve their fulfillment as well. So the
Yeah,
language
yeah.
is so important.
Yeah, no, I do agree. And I think what I've been learning, excuse me, what I've been learning more recently is that people in general really do want to know what your opinion is and what your like and how to treat you because people don't treat you just out of them doing it. They treat you because that's you allow them to treat you a certain way, so good or bad or indifferent. People treat you how you allow them to treat you, so speaking up for what you want is huge.
Exactly. And yeah,
Hmm.
you teach people how to treat you, good and bad. You're
Good
right.
and bad, yes, good and bad. Okay, so the last tip of better vaginal health is speaking up or saying yes to sexual experiences that serve you. And I feel like that's going along the same lines of, as I was saying earlier in the show, I was not always into my own pleasure. I was always into, or oftentimes into the pleasure of my partner. And my pleasure usually came last, or it didn't happen, or whatever it may be. And so I have learned for myself through classes, through conferences, that really saying yes to sexual experiences that serve you feel so much better in your body rather than doing it to serve the other person. So I think that is a huge thing that we all can do and can make our vaginas feel better, our vulvas feel better.
Yes, I totally agree. On that note, as well, I think everyone kind of can play into a role that maybe turns them on. So I think for some people, I know I've had partners that are like, the ultimate thing that pleasures me is watching you derive pleasure. And I think you have to also be matched with someone who is going to inhabit that space with you, who really wants to see your pleasure and also enjoys it themselves. But I think, and this may be a little heteronormative, but I think with like men and women, at least in my experience with patients and my own experience, I think that when you really own your pleasure, if you are with someone who's very, sexually connected with you, they want to kind of like let you blossom, let you bloom, kind of like let you really enjoy that and let go. And so I think that finding someone who is into your pleasure and kind of owning it and really being in your body. And I think a lot of things that can help you get in your body are even just like body work, like yoga, biofeedback, breathing exercises, Tai Chi, exercising. Like I think for women, and I love the author Glennon Doyle Melton because she talks about this in her book Love Warrior, which is like a lot of women become disconnected from their mind and their body from a very early age because our bodies are seen as like something for consumption or for other people or performative. So I think when we're able to get into our body more in our lives and be able to connect with like a pleasurable experience, because I think for a lot of people, because of trauma or whatever, they kind of dissociate or they're not able to get into their body. So I think doing these practices are so important for you to be able to connect with your body and have that experience of intimacy with another person.
Yeah, I agree. And kind of going along the same lines, and I've said this before in other episodes, but I do believe that if we are not able to know what's going on in our body, and if we're not able to express certain things through our words, that they can, or if we have trauma from the past, it can express as physical symptoms. Like I really do feel that it can express as,
Totally.
different symptoms. I mean, even for people with high blood pressure, if they are stressed out, their blood pressure can get higher. Like if they are not able to calm themselves down or to relieve that stress in some way, it can lead to really bad blood pressure, even if they're on medications that can control it. So I do believe that there's a lot of listening to our bodies and serving our bodies. So if you are in that stressed out situation, figuring out ways to de-stress, meditating, going on walks, being in nature, doing whatever to come back to a normal state.
Completely. I think that goes back to Esther Perel's idea of how we kind of stoke our own desire, open up to new experiences, open up to people. I see a lot kind of in Silicon Valley where I practice. People are so overworked. They prioritize
overworked. Oh my gosh.
Overwork. They prioritize achievement, money, and I get it. It's a tough place to live here in San Francisco, but you really have to think about also what type of satisfaction you're deriving from your relationships and how do I show up and be present for this person who I've committed to, or who I want to have a pleasurable experience out of. And it's all related, kind of like we talked about at the beginning of the podcast.
Yeah.
How much you're taking care of yourself, how much you're kind of connecting to your body, how much if you're overworked, it's really going to be so hard to do those things.
There's so many patients that I can talk about, and of course not giving names, but there was one woman that came in and she had a really stressful job and she was not able to come to the doctor very often, and she was not and I work in an urgent care, and she was not able to come to see her primary doctor very often, and she came to see me and she's like, I'm just really tired and like I could barely get any sleep, and when I do try and sleep I just continue waking up, and I'm just like super just overall fatigue. Like, can you do something about this? And I was like, and then I was asking her more questions, and there was no type of exercise, there was no type of meditation, there was no type of serving herself in her life. other than working, other than traveling to see your family, other than, so it was just doing things for other people. And I was like, you have to. I just looked at her and I was like, I can do all the workup, and, we can see if there's any medical causes to explain the reason for your chronic fatigue. But I think a big part of it is taking care of yourself, like doing things that are pleasurable for you. Doing
Yes.
things pleasurable for you.
Honestly, this concept of pleasure for no reason is like so mind-blowing and radical in today's day and age, where our attention is literally competed for every second. And how do we turn some of that focus and attention that we give to our jobs, to our bosses, to our social media, to our businesses, which is all wonderful. But at the end of the day, your pleasure and satisfaction with life is going to come from your relationship with yourself and your relationship with other people.
Yeah.
So how do you really invest in that? I think that's pretty much the foundation of like my practice with patients, is like all vested on that, because it relates to everything. How are you? Sometimes it has to do with, sometimes it comes out in the form of like, let's have an honest conversation about what's really going on here. You are working too much, and it's like, it seems so basic, but obviously that's after you've done a workup, made sure that it's actually nothing medical, and you can say safely, like, this is I'm concerned about you, and it's let's talk more about your self-care regimen, therapy, your physical, exercise plan and things like that. So also important.
It is also important. So I think overall, just increasing your self-care is going to benefit you the most. Doing things that pleasure you are going to benefit you the most. And recapping on our 6 tips for better vaginal health. So we have 1, taking probiotics. 2, going along the same lines, maintaining a healthy pH, so avoiding certain products that have things that can irritate the vagina and the vulva. 3 was masturbation.
And STD.
Oh, STD, yes, STD testing, regular STD testing, especially for new partners, even if you're in a committed long-term relationship. 4 was avoiding douching and the reasons why to avoid it. 5 was masturbation and regular masturbation, not too much masturbation, but regular masturbation with a partner or by yourself. And then 6 was saying yes to sexual experiences that serve you. So that is, yeah, snap, snap. Yeah. So those are the 6 tips. And I just want to thank you so much, Dr. Lunderville, for being on the podcast. Before you go, I have a couple questions for you. So I've introduced you as having a concierge medicine service called Elevate Spa, and wanted for you to leave the listeners with how people can find you online. I know you do parties and things like that. So how can people find you and follow you on social media?
Yeah, I have a concierge practice where I do aesthetics. So we do Botox, filler, skincare, all different types of things. But what I love is just these conversations around female empowerment, supporting other women, listening to our bodies. Again, it's all connected. So I actually host parties in women's homes. I also host my own events. And you can find out more on my Instagram. It's at Elevate Spa Services, and it's the same for the Facebook. And our website is www.spaelevate.com. And so you can book basically to have a doctor in your home talking about whatever topic that you want. I love this because it's really women coming together in community, like we talked about. You kind of disrupting the clinic. You get out of the clinic walls, which can be intimidating, which can kind of be this like one way passage of knowledge. And what we really do is we talk to women about, like, what do you do for your health every day? What are you doing? And women will share, and then I will come in for any questions, kind of give my tips. So it's a really beautiful space that we create. So you can book a party, look at our upcoming events, and then book to see me individually as well.
Great. And I will put all of those links up in the show notes in the description for people to contact you. And if you can, since the podcast is called Viva la Vulva, I know that you said that you had a vulva story that you may have said before, but if you can leave the listeners with something uplifting, a fact or a knowledge, or you can just recap what you talked about earlier.
Well, I kind of already talked about my story,
Okay.
which, has to do with how to completely let go and abandon within a sexual experience. But I think my other fun fact is that when I was in medical school and I learned that the clitoris is basically like the analogous penis because it's the same erectile tissue, it just like blew my mind. I think that's studying the development of the vulva and how intricate and beautiful and how it's made of different tissues and why that, how many nerve endings are on. I forgot, Cara, how many nerve endings from medical
8,000 nerve endings.
And it just makes me marvel at the beauty and the power of the vulva and the clitoris. So may we continue to live in that power and
yes.
support.
I love it. May we continue to do that. All right. Well, say that again.
Oh, I just said thank you for this space and this opportunity.
Thank you for being on the podcast, Dr. Lunderville. I really do appreciate you and all of the tips that you provided and just the services that you offer. I do appreciate it. So thank you for being on the podcast. And thank you for listening to the Viva La Vulva podcast. Bye.
Bye.